The scratching started at 2 a.m. Not the ear-flopping, tail-chasing kind of scratching. The dragging kind. You heard Max's nails on the hardwood floor as he tried to get up from his bed. That hesitation before he committed to standing. The low groan he let out on the third step down the hallway. You've been giving him that joint supplement every single morning for 8 months. The bright green tub, the vet-recommended sticker, the 5-star reviews. And yet here he is at 2 a.m., stiffer than he was a year ago. What if the supplement was never actually the problem, and it was never really going to be the whole solution either? Hi everyone, I'm Dr. Scott Reynolds, your neighborhood veterinarian. I see this exact scenario in my exam room at least twice a week. A devoted owner, a shelf full of joint chews, and a dog who's still hurting. Because the supplement aisle has become one of the most confusing, most poorly regulated corners of pet care in the country. In the next few minutes, we're going to walk through what's actually happening inside your dog's joints. How to tell if what you're seeing is early arthritis or something else entirely. The one mistake that quietly wastes owners hundreds of dollars a year. The safe way to actually support a stiff joint. And exactly where the red line is between let's manage this at home and we need x-rays today. If you've got a dog who's slowing down and you want to actually understand what you're dealing with instead of guessing, go ahead and subscribe, because this is exactly the kind of thing we break down every week. Let's start with what's really going on under that fur. Your dog's joints are held together by cartilage, a smooth, rubbery cushion that lets bones glide against each other without friction, kind of like the tread on a tire that keeps rubber from grinding against pavement. Over years of normal wear, or faster in large breeds, overweight dogs, or dogs with joint conformation issues like hip dysplasia, that cartilage thins. As it thins, the joint space narrows. Inflammation builds inside the joint capsule, and the body responds by laying down extra bone at the edges, what we call osteophytes, or bone spurs. This entire process is what we mean by osteoarthritis, and it's progressive, meaning it typically worsens gradually over time, rather than appearing overnight. It's not usually one dramatic injury, it's tread wearing thin, 1 mile at a time, until one day the tire's bumping over gravel it used to glide right past. So how do you actually check what you're dealing with at home, safely, without guessing? Watch your dog's first 10 steps after a long rest, after a nap, after a full night's sleep. Dogs with early arthritis often show what we call startup stiffness, a hitch or slowness in the first several steps that noticeably loosens up once they've moved around for a minute or two. Run your hands slowly along each leg while your dog is calm and relaxed, feeling for any joint that seems warmer than the others, or any spot where your dog pulls away or turns to look at you. And here's a myth worth correcting right now. A lot of owners assume if their dog isn't limping, their joints must be fine. But dogs are remarkably good at hiding pain. It's an old survival instinct. So subtle behavior changes matter more than obvious limping. Slower on stairs, reluctant to jump into the car, sitting off to one side instead of squarely, taking longer to settle into a lying position. These are often the real early signals, well before a visible limp shows up. Now here's the mistake I see constantly, and it's the actual reason so many supplements seem to do nothing. Owners walk into a pet store, grab whichever joint chew has the biggest vet-recommended banner, or the most 5-star reviews, and start giving it without checking 2 things that actually determine whether it can work at all. The dose of active ingredient per your dog's body weight, and whether the product has actually been third-party tested for what's on the label. This matters because glucosamine and chondroitin supplements are regulated as a food category, not as a drug, which means the FDA does not require manufacturers to prove the amount on the label matches what's actually in the product. Independent lab testing over the years has repeatedly found joint supplements with a fraction of the labeled glucosamine content, and in a well-known analysis, some products contained less than half of what the label claimed. So an owner gives the chew faithfully every day, at what looks like the right dose, but the dog may be getting a fraction of an effective amount, and then reasonably concludes supplements don't work, when the real issue was never given a fair chance to begin with. The safe alternative isn't a different miracle product, it's a different approach to choosing and using one. Look specifically for products carrying the NAS Quality Seal, which stands for the National Animal Supplement Council, an independent body that audits manufacturing facilities and testing practices for pet supplement companies. Then check the actual glucosamine and chondroitin dosage in milligrams against your dog's weight, rather than trusting a company's own generic serving suggestion, because a 15-pound terrier and an 80-pound Labrador should not be getting the same chew from the same bag. And give it consistently for a full 8 to 12 weeks before judging whether it's helping at all, because glucosamine and chondroitin work by supporting the raw materials your dog's cartilage uses to repair itself. They are not anti-inflammatories and won't produce a dramatic overnight change the way a pain medication might. Let's talk tiers. From mildest cases to more advanced stiffness. For a young or middle-aged dog just starting to show occasional startup stiffness, the first tier is weight management combined with a properly dosed glucosamine chondroitin supplement. Because excess body weight is one of the single most significant modifiable factors in joint stress. Even a 10% reduction in body weight has been associated with meaningful improvement in mobility scores in overweight arthritic dogs in veterinary studies. The second tier, for dogs showing more consistent stiffness, is adding an omega-3 fatty acid supplement, specifically formulated for dogs, ideally one providing EPA and DHA from fish oil, rather than plant-based omega-3 sources, since EPA has real anti-inflammatory activity in joint tissue. A general starting guideline vets often use is around 75 to 100 milligrams of combined EPA and DHA per kilogram of body weight daily, though your vet should confirm the right amount for your specific dog. One safety caveat here that matters. Fish oil can interact with certain medications and increase bleeding risk, so always tell your vet you're using it, especially before any surgery. The third tier, for dogs with more visible discomfort, is short, controlled, low-impact exercise. 5 to 10 minutes of leash walking on flat ground twice daily, or supervised swimming if your dog tolerates water well, because moderate movement keeps joint fluid circulating and muscles supporting the joint from weakening, while high-impact activity like jumping off furniture or running on hard pavement should be minimized. The fourth tier, and this is where home care alone stops being enough, is when your vet prescribes an actual anti-inflammatory or pain medication alongside the supplement. Because supplements support joint health, they do not replace prescription pain control once real inflammation has set in. Here's my favorite trick, and it's genuinely one I use myself with my own older dog. A warm compress, a damp towel warmed to a comfortably warm temperature, never hot, applied to a stiff joint for 5 to 10 minutes before your dog's morning walk can noticeably loosen a stiff joint by increasing local blood flow. The same reason physical therapists use heat before mobilizing a stiff human joint. It's not a treatment for arthritis itself, but it's a genuinely useful, zero-cost way to make your dog more comfortable before activity. And I recommend it to almost every arthritic dog owner I see. The safety rule here is simple. Always test the temperature against your own wrist first, because a dog's skin can burn at temperatures that feel merely warm to a thicker human palm, and never leave a heat source unsupervised with your dog. Now, the part of this video that matters more than any supplement chart. There's a real line where home management stops and a vet visit becomes non-negotiable. If your dog suddenly stops bearing weight on a leg entirely, rather than gradually stiffening, that's a different problem than arthritis and needs same-day evaluation. If you notice sudden, significant swelling around a single joint, or the joint feels hot to the touch on one side compared to the other, that can indicate an infection or acute injury that needs imaging and possibly joint fluid analysis, something only achievable with X-rays or ultrasound in a clinic. If your dog cries out sharply when touched, stops eating, or seems suddenly withdrawn alongside the stiffness, that combination points to significant pain that needs proper veterinary-grade pain management, not just supplements. And if you've been managing mild stiffness at home for more than 4 to 6 weeks with no improvement at all, that's your sign to get actual X-rays, because we can't tell from the outside whether we're dealing with early arthritis, a torn ligament, or something more serious like bone cancer, and only imaging under proper positioning, sometimes requiring light sedation for an accurate read, can tell us that for certain. So here's how this all fits together. Your dog's stiffness isn't random, and it isn't something a single supplement was ever going to erase. Cartilage wear is a gradual process, and supporting it is a gradual, layered effort. Knowing what to look for in those first 10 steps, choosing a properly tested and correctly dosed supplement, adding omega-3s and weight management where they genuinely help, using heat and gentle movement to ease daily discomfort, and knowing exactly when it's time to hand things over to imaging and prescription care. None of that is failure. Catching subtle signs early and knowing when you're out of your depth is what responsible, attentive pet ownership actually looks like. And honestly, it's more effective than anything in a green tub with a 5-star sticker on it. I want to hear from you in the comments. What's the very first sign that tipped you off that your dog was slowing down? Whether it was a sound on the stairs, a hesitation before a jump, or something else entirely. I read every single comment, and these details genuinely help other owners recognize the same signs in their own dogs. If this helped you understand what's really going on with your dog's joints, hit like and subscribe so we can keep reaching worried pet owners who are standing in that supplement aisle feeling just as confused as you probably were before this video. I'm Dr. Scott Reynolds. Stay safe, and I'll see you in the next one.